see. Get things rolling. Who has not had or who has had back pain or hip pain? Everybody has for the most part. Okay, if you walk around, move around, it can happen. But I want to teach you how to how to help yourself recover, but also most importantly, how to stay healthy. My biggest thing with seniors, especially, I think I'm 51 now, so I qualify almost, is a lot of it is we want to stay independent, right? If we lose our independence, we can't walk, we have a hip issue or a back issue, then our whole body is thrown off. Then we can't do our own day. So I want to make sure we have enough information today, and not a lot of exercises, but if you can start doing and checking out, so we know we're walking well, we're moving well, we're doing things to prevent back pain and hip pain, but also doing things to keep our hips and backs loose, as well as strong. I'm a chiropractor in Upland. I'm here locally off Mount 11th that we just moved, Mount 11th. And a lot of it is I want my patients to get to where they feel strong. At that point, you know the pain stays away by having that. That's the key for most people. Okay, so number one thing I start with for most people all the time, especially my patients, I go here, and what I do, real simple. It's simple for me, I guess. For some people, it doesn't seem easy. If someone has a back or hip pain, what do they normally do? Do they lean back more or do they lean forward more?
Forward.
Forward, right? Okay. If they're forward, what happens to their body? Everything tightens in your hips, gets weak in your back. Let's make all of this position better over time this way. So how do we know where we are right now, today? February 19th, 2028? Whatever year this is, I don't know. I'm skipping years. But what I have my patients, I did saw 3 this morning. Go against the wall, watch it, and this one to watch for nails too. I've learned in my past. Make sure you go against the wall with your heels, hips, shoulder, and head to see how you feel. If someone's leaning forward, they're going to feel like, man, that causes some hip strain here and hip and back strain here. They may even feel if their normal is here, hunching forward, they're going back too far. Because right now, so realize if they're normal in their head, their straight is here, that's their straight. So when they come back more than what they're used to, they feel like they're going too far back. Any questions about that? Patients do. Number one thing, get against the wall, heels, hips, shoulder, and head. Boom, from there. Once they feel comfortable here and they go, this is what I'm going to get to over time, I want to take a step forward. Okay, now we're going to be off the wall, less support. So now we have to balance our own body, weight on the heels, so we stay up here and walk heel to toe versus being on your toes the whole time. Tell my patients too, when you're walking, I don't want to hear you walk. No sliding, okay? I want to make sure anything, as people get better, they start rolling their feet over time instead of stomping or sliding. That's the big picture with everything we do. Because what we do all day long, we walk, we get out of a chair, we stand, we sit. But people come off, it's not because they fell, had trauma, because over time their posture caused back pain by just lifting a piece of paper. Brush your teeth over a sink. Those kind of things would happen from a minor event per se versus a trauma or a fall or a car accident tells me there's something going on. So I always check the posture first. Again, one more time. Heels, hips, shoulder, and head. So we learn this over time. Then when we walk heel to toe, not slide or stomp. All right, and I have other talks too you can see on my YouTube. I'm later, I think this I think in March or May, one about walking specifically. But this is more just the idea of how do we get everything loose here and balanced between your hip, front hip and back hip, balanced here again, so when we walk, when we move, that doesn't cause more problems. All right, any questions yet? Nothing yet? Makes my job easy. So now, foot placement. What do I mean by this? Let me back it up a little bit here. People can see at home on the tube. Here, I don't. Here is to where if my feet, when I stand, my foot is coming out, say to one side. I'll go over there in a second too. What does that do to my back? Does my back and my hips now have to shift to make me feel comfortable. People have a lot of problems with tight outside muscles called TFL band or ITB band. That makes things want to pull your foot out. Now dropping your arch, causing your hips to become unlevel, causing more back and even upper back pain too. So I want people to understand, besides the wall posture check, we also want our feet to be straight here instead of being foot turned out, either one or both. So same thing over here too, so you can see it over here. Is I want to make sure my feet are straight. When I'm standing, when I'm walking, I'm not doing this here, dropping my arch, dropping my hip, cause hips to rotate, cause too much torque in my back. Same thing here, either other side, causes to drop in, here, so my body has to shift, or both feet, because both feet coming out, when both feet come out, what happens is now the back muscles here have to tighten everything up to hold together, because you're pushing your hips in biomechanically versus being more open out this way. Any questions about that? Yes, Sylvia. Sylvia 1. I'm going to call you Sylvia 1.
Oh, okay, that sounds good. My pain is right here on the side, but it's more in some exercises that we do.
Mm-hmm. You're getting your hips stronger from the surgery, yeah.
So I have to kind of, on the side instead of going straight up.
And keeping the muscle loosened. So make sure we're doing, when you're doing that side, so we're doing a side kick, we're still pointing our foot forward. We're not allowing it to come out. Because at that point you're allowing your quad muscle here. Your quad muscle is one muscle. You have your medialis, magnus, and lateralis, but you have your TFL on the side also that supports you, so it can cause that whole hip to take over to pull you out versus keeping that hip and that foot in to come straight up.
Well, instead of, if we're doing any exercise where it's straight it hurts. So I have to go.
Yeah, makes the hip hurt.
Yeah,
So it's almost like,
it is, it's okay.
but make sure if we're gonna do that, which is fine exercise-wise, make sure we're still walking and creating your muscles to stay even here, not pulled out when you're walking or standing. Just make sure you reset everything after your exercises. That's what I'd be careful with. So we don't learn till we're stronger here, so we stay here the whole time versus staying more in. Just be careful with that. No, that's the key, Sylvia 1. Okay? Now, leg length check. What do I mean by that? We talked about a second ago. If my foot's coming out, my hips then shift here, but I'm not necessarily going to turn my whole body or even walk in a circle. My hips will shift and rotate, causing my pelvis on my left to drop and my one on my right to come up. Okay, so if I'm here, just on this side too, if I'm here, my foot comes out a little bit. Now this pelvis has to drop and rotate, but I want to feel like I'm on my left side. So what it'll do is actually rotate, so I maintain my balance in the center at that point, but now my hips are shifted. If I'm here and walk long enough, sit long enough, stand long enough, the muscle imbalances will cause me a problem. So again, same thing. If I'm shifted here, with this side being, for example, tighter in that hip, and we drop that hip, now my body's going to sit on my left side. It doesn't want to do that. It want to come back to center, but maintain that twist as your normal default. So I want to make sure we check for that too. So who wants to be my first volunteer today?
Me.
Me? Come on over. Come on over, me. I like this. Good. And your name is again?
Joanne.
Joanne Tony. Nice to meet you.
Nice to meet you as well.
So
I have, when I wake up in the morning
Okay.
and try to get to the bathroom, it feels like my body will,
shifted.
it shifts like this.
Shifted
I'm
over.
walking like this, holding onto the wall until like about a half an hour until I warm up.
Loosens up per se. So let's check something with you. I'm going to have you sit right here on the middle and then lie on your back all the way.
Okay.
There we go.
Sorry for being old.
That's okay. We can't get younger. Not yet, at least. Technology isn't there yet. You know? So lie on your back all the way for me.
With my head here.
Actually, head there, yes, on that side. Okay, I want to show you something that might be the reason why. Good, good. So what happens is, take your time, on your back when you're ready. On your back, yep, all the way. Yep, of course.
I'm afraid I'm going to fall
My leg's on the table, you're not going to fall. There you go. Joanne, let the legs go straight for me. One more time. Yeah, perfect candidate. Right now, we are a little bit lower here and higher here. Okay? How I'm going to show you that is right now, make sure, yeah. So right now we're doing this, Joanne. Is we're here, we're higher and lower, so your body wants to sit this way. So it wants to tilt. You said more to the left side or right side?
The right side is lower.
Got it. So now your whole body is almost doing this to compensate when you get up in the morning. So I'm giving you a couple stretch start doing right now, if that's okay with you, to get that position back to center. Okay, so right now if I see this here, what I'm going to do, let me do this here too.
Want me to take my shoes off?
Nope, you're good right there. Okay, what I want to do is for you to feel when you bring your leg off the side here, a little bit more. Is that okay with the hip?
It kills. Yeah, it's small my back.
Yeah, so right, your back is way too tight on that one. So if you come just right here and let that go right there, is that okay? Okay. Yeah, so right now, if we're tight in the hip, we're going to be weak in your lower back. That make sense?
Yes.
We're off balance. So if we're tight here in my hips, my back is going to be way too weak to feel like I can do things until I warm myself up. It needs that, like you had mentioned, the vertical load of standing, moving around a little bit, for your back to loosen itself up. All right? So switch sides for me too. Bring this leg back for me. This side over here, John. How does that feel?
Terrible.
Yeah.
This part over here hurts.
We have to make sure we do more stretching. And I'll show you a couple more, okay? So right here for me. I'm gonna jump on this list a little bit based on what Joanne's feeling. Is it Joanne? Joanne?
Yes.
Joanne, what she's feeling right now to kind of show you what I do with my patients who have hip pain, back pain combination. How long have you had it for?
Oh, 20 years.
Yeah. So your muscles have made this your normal. So I'll give you some stretches to start doing slowly today, and over time, add them over a period of 3 or 4 weeks so you can do more and more. But how often should we stretch? Every day. Boom, I train my people well. All right, every day. So we'll get a couple things to start doing. So yours would be right there where you are right now. Bring your leg off the side again, like we did a second ago. Just outside of the bed for about 30 seconds to a minute on both sides. Okay? So one side at a time. Bring that leg back again. And slowly, when you stretch your hips or your back, by holding the stretch, not going back and forth, movement, by holding the stretch, allows ligaments in your hips to stretch and your back, not just the muscle. Because right now it feels more deep in the hip, correct?
Yes.
Yeah, that's more ligaments deep in the hip versus being more superficial muscle on the outside. So yours would be both sides for about 30 seconds to a minute. And every day. All right, bring your leg back for me too.
How do you do that? I don't have a table like this.
What side of the bed?
Just on the side.
Side of the bed. And as you get better, you can bring your leg further off and bring your foot down to the ground too when you're ready. It'll get there. They're not right now, maybe, because it's too tight, too sore. But over time, as you're comfortable, then it'll be easier.
Okay.
All right, another one for you too. Let me go right there for 1 second. Is you want to do is, it's going to be too much for you for one too. Let's do a different one. So here, I want to
Are you talking about putting your shorter leg, stretching your
actually
shorter
both legs. I want to stretch both legs. So one leg at a time, one side, then the other side next time. So go back and forth just once for now, just for once. Okay. One for yours. Still going to try something different off the paper. Bend your knee for me. And bring your foot here inside. It's called the butterfly stretch for your hips. Your hips sometimes get tight and they tie up like a piece of rope. They wind in. We're going to unwind them a little bit coming out on both sides. All right, so when they get tight here again, the hips, they pull you forward, but also bring your legs in, causing more pressure, causing back weakness. So I'm doing now, Joanne, is let your leg here slowly drop out to the side. Does that feel okay? Keeping that foot on the inside knee. How does that feel?
This part hurts.
Yeah, more the muscle. Because it's wound in, it's going to cause things to not want to wind out. Does it hurt or is it uncomfortable?
It hurts.
Okay, so want to go a little bit less. And when you say stretching, it's more of where it's uncomfortable but not painful. If it's painful, it's going to be almost guard tight and make it worse. You'll just be angry and sore. That won't be good. And avoid that.
How
Right
many
there.
times a day should this be done?
Depends how someone's severe it is, at least once a day when you're feeling good. But if you're feeling like things are real tight and sore, morning and night. So we sleep and get up better, wake up better, versus feeling sore all the time. Switch legs for me too. All the way down, Joanne. Now switch legs. And slowly let this leg drop out. Does that side feel okay?
Yes.
Good. So where you're comfortable, hold that for
Where
30.
it hurts, right there.
So we'll go right underneath that for about 30 seconds. Just give it time. 30-second stretch of holding the stretch so your hip ligaments can actually unwind to get that pressure out of there. All right. I'm going to have you sit up for me. Now what I want you to do is move your knees to the edge for me over here. All right. Change the camera a little bit. So here, I call this the edge stretch, edge of the bed stretch for one. We've done this before also. What this will do is get your lower back to stretch a little bit more. Okay? So I'm going to have you actually scoot up a little bit for me. Scoot up, sorry, scoot that way for me.
This way.
There we go, right there, perfect. Now come all the way down on your back for me. All the way down.
Oh, yeah.
So now let your leg muscles relax. Do you feel a little pull in your lower back right now?
A lot, yeah.
So scoot up a little bit more. Scoot up that way for me more.
This way.
Yep. Right there is perfect. Let your legs hang for me a little more. Okay? When someone has a lot of back pain, what happens is the legs can be used to get that low back to open up and decompress. That's the plan with this one. So her being so sore right now, does that still feel a little bit of a stretch?
Yeah, this doesn't hurt as much.
Good. So we want to stretch a little bit so as we get better, things become more flexible, we can bring the legs further off the table to allow more of the weight of the legs to get that back to decompress. Your body's the best thing you can use to stretch. You don't need a lot of other tools and crazy gizmos. It's more than letting your body stretch. As you feel comfortable over time, Joanne, you can allow your legs to slowly come off the edge of the bed more and more as you get comfortable. It just takes time. I recommend patients for this stretch here, because the low back muscle ligaments are pretty thick and you have about 7 layers of back muscles, about 5 minutes of this type of stretch. Give yourself time to loosen things up. Don't rush your health. Is that okay? Yeah. Good. Stay right there for 1 second. The other ones are wall ones, you'll be okay with those. All right? So any question about the stretching?
Yeah.
That's what I would start doing for one. At that point, see how your body slowly opens itself up, especially when you get out of bed. Because when you're, like I said, when you wake up in the morning, Joanne, your body feels real tight, and it feels almost like you're already twisted. I like this at night before you go to bed. Also, when you wake up in the morning, same thing.
Okay.
All right? You want me to help you up?
So I do have a question about
Yes.
that. When you wake up in the morning, what for your legs if they cramp down the lower
Calves?
knee? So what is the best to stretch them to heel first?
More-
It seems to be worse if you do toe.
You almost want
That locks
to. You almost want to give it. Almost rotate your ankles a little bit first, if your calves cramp up, then slowly bring your toes up.
So it's a rotating. I didn't.
Rotate, and then once that feels comfortable, then bring your legs up. So have you stand up when you're ready. There we go. All right. 1, 2, 3. Jump. Oh, there you go. I got it. I got you. There we go. Yeah. Is that okay?
Yeah. Sit down.
Yep. Grab a seat. Thank you, Jeff, for volunteering. And that's the thing is, as you do more stretches, you'll feel more comfortable doing it. It just takes time. But again, this one is where you want to eventually get to the point where you got to work out, Joanne. Here, where you can slowly get your legs off table like this, come all the way down, and come all the way up. That's the normal goal. That's how I stretch. That's how I take my power nap every day. That's what I do. All right? Yep, grab a seat. Right here. Right there. So now, another one too, I tell people, can I grab a chair? Okay. Yeah, grab it there. That's good. You get the front row. Whoever is late comes in, gets the front row. So now, how many people have pain when they go to stand up? Me too sometimes, okay? So you want to do, to stand, when you're sitting, the problem is when we sit or stand too long in a bad, when I say a bad position, not a normal position, then our body tightens up. Same thing when we're sitting. I talked to a patient this morning, is here, if I'm sitting like this all day long, my back is hunched forward, my spine's compressing, my hips are getting tighter versus staying loose, my back is getting more stretched out, causing more weakness. So I'm going to do a chair like this. I'm going to sit in the very first third of the chair, bring my feet underneath me so I'm more upright. Okay? So where you're comfortable, bring your glutes, your tush forward in the chair. Try to get your knees below your hips and your feet underneath you so your body is more here upright like we're standing, more active contraction of the muscles versus being here in front. I had someone who goes to work and her ergonomic person said, put a little stool in front so we can sit like this. We're not watching TV. We're trying to work. So I'm not going to this feels uncomfortable to me. But if we can stand and relearn to get our legs, if you can, our feet underneath us on our toes, knees below our hips, that allows the hips to slowly come forward versus being back where it builds up more pressure. So you want to stay forward. You want to feel you can put your hand, your fist, in your lower back and have a little bit of rounded lower back to sit your body more upright. Because when we actually do this, we want to lean back to rebalance our body. Now our shoulders actually naturally drop. Our chin comes back over our shoulders versus being stuck forward. What happened during COVID? Everyone sat for a long time. So I was busy with back pain, neck pain. I had job security. I was good as a chiropractor. For you, I don't want to see if you have good posture. So again, knees below your hips, feet underneath you, roll your lower back, put your fists down there if you need to, kind of hold that position for a second. So our body resets here instead of here. Okay, instead of here. So people say, well, I have to work this way. That's fine. Can you work, again, everyone's different, with your looking down over your nose versus with your eyeballs? Is that possible? Can we do this and look down over our nose? So we're not forced to hunch forward. That's the plan. Good job, good job, good job, front row. That's it. That's it. With keep our body back. So it's the posture. Standing posture, talked about a minute ago. Sitting posture also, and some stretches forward also. Yep. Another thing. Here, once we get things loosened up enough, okay, how do we now get stronger to hold that better position so our body doesn't want to go back to what it's used to before? So here, again, my favorite wall over here is how do we now relearn, get these muscles now to hold us up in your lower back, your hips looser too, so everything back here gets stronger versus being weak and tight. Okay? So after stretching feels good, I'm going to progress to, I call it a hamstring stretch, more of a modified deadlift, where you go against the wall, feet right in front of you, and then slowly, hips on the wall too. You can see easier from the side, I'll show in a second, is here, let your hands slide as far down as you can. Hold that for 10 seconds, and then slowly slide your hands back up. And when you come back up, try to use your back muscles more to pull you up, if you're comfortable, come all the way and touch the wall.
How many times do you do?
3 times. And what I recommend 3 times is, as you come down more, you go a little bit further, but by having your hips on the wall, you're supporting your back. So if your back is sore or tight, you can still do this because you have that support here. Again, sliding down. Hold for about 10 seconds. 1, 2, 3, 10. I skipped some numbers, just want to let you know. I know how to count, people. And then come all the way up. All right? Any questions about that? If that gets comfortable, and you can do, over time, come off the wall, and then come down, hold for 10 seconds, and then slowly come up. But again, this is modifications, right? Feels good, then come off the wall. Because when we come off the wall, we have to use our muscles more to really focus on balancing our feet nice and level. Hold head up the whole time, smile if you want, and then come back up. All right? Any questions? Who wants to try it? Try it? Come here, come up. I want to see what you feel. Because if our back is tight, hips are tight, hamstrings will be also tight. All right, so up against the wall over here for me.
Okay.
Good. Here, feet off the wall a little more and more. Hips on the wall, hands here, and slide down slowly. Head up, head up, head up. Hold where you're comfortable. And then slowly come back up and touch the wall with the shoulders first. So when you come up, you want to make sure you're coming up and making that back really straighten out to make these muscles down here work more. Good. Good. Nice and slow. And again, you smiled. Perfect. All the way up. Good. Good. Does that feel okay?
Yeah.
Do you feel it more in the hamstrings or more to the back when you do that?
Like,
Yeah. So your legs, when your legs are tight, that point coming down will stretch everything out, leaving your body weight. As you come up, then use your back muscles to pull you back up all the way. All right?
yeah.
Good. What's your name?
Suling.
Sulaine? I'll make you famous on my YouTube video.
Oh, thank you.
You're welcome. Grab a seat. All right. Now, as we get comfortable, we want to build more strength in our legs and also our lower back a little bit. So what I want to do, I call it a static wall squat. I think that's what it's called. Watch out for the nails again here. You want to do is bring your feet off the wall, maybe about a foot, foot and a half off the wall. And then slowly, where you're comfortable, put your hands here for support. Let your body come down the wall where you're comfortable and hold that position. That's too much. And then, Joanne's like, what the heck? So where you're comfortable, come down, hold, 10-second hold 3 times, 10-second hold 3 times, and then come up. If it feels like your leg's getting weak, then push yourself up and walk yourself back.
That was
All right. 3 times for 10 seconds.
But we can do it in the swimming pool, no? Because
Yeah.
sometimes it's hard to go lower like you.
Yep.
But in the swimming pool, we can do it like.
Yeah, you go for that.
We feel comfortable, no?
Yeah. You have more buoyancy feel, but just make sure so you don't go too low, because you go too low, you go underwater. Underwater, then you drown yourself. And like Dr. Tony said to go lower, so I went under the water. I can't breathe. All right. Yeah. And same thing from over here too, from the side view. Other group too is here. Same thing, just so you can see over there. Feet straight, hips on the wall. Come down. Hold for 10 seconds where you're comfortable, then slide back. When you come up to, make sure you use your legs more, not your hands. So what I mean by that is I'm going to come here, all the way down if you can. Hold. Then slide all the way up. All right. Yay. Good job, good job. Yeah, come on up, of course. Let's see. All right. Ha. Let's see. If there's only floors only like 3 feet away, you're fine. Kind of come. There you go. So here, right there. We're gonna come all the way down. Head back, head back, head back. Hold, 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 hold. And then come all the way back up.
Can you get up?
Push, 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 push. There you
I
go.
went too down. I went
Too
too
much.
down. That was too much.
You'll get used to it though. Thank you, thank you. See? And if that gets comfortable over time, you can do modification is now from where you are is take your stance again like the wall before, then come straight down if you're comfortable, and then come back up. If you need to, even use the wall to come down a little bit, hold, then come back up. Again, the wall is supporting your back, so as you get comfortable, you want to use all the muscles to really let your body slowly come down here. All right? Another one. How do we make, if the hamstrings are tight, back needs strength, right? How do we make the back muscles stronger? There's 2 ways to do this one. It's called more of a kickback. So I'm going to go on the wall here. I want to make my back muscles, rectus spine muscles, high glutes stronger. I'm going to do here on the wall, support one foot up, weight on one foot, and slowly bring the other foot up here. You can start just your foot, just your toe off on the ground just for a second. When you're comfortable, come up, hold for 5 seconds, come back down. Now switch your weight to your left side, and now bring that right foot up on a toe for a second. 5 seconds, foot off the ground, all the way down. 3 times both sides. Modified kickback. Okay, who wants to try this one? Who wants to volunteer for this one? Anybody? Come here, come one more time. We'll do the other ones because you're pretty strong, so do the other one with you too.
See exactly what you did, but just
Perfect. So hands on the wall here.
oh, like this. Oh, see, I don't see this part.
That's okay, hands on the wall. And now what we're going to do is bring your toe up.
Oh,
And
oh,
now,
my toe.
toe first, and then bring your foot back. Hold for 5 seconds. Good, toe back. Then foot on the ground. Then shift your weight on your left side. And now bring that left leg up and toe up for 5 seconds off the ground. Back on your toe, and then back here.
Okay, I didn't see this
No,
part.
no, it's okay. It's okay right there. Now the other one for you.
For me.
For you, because you're special. Okay. So here. I want you to do is grab a seat right here. And from here, I'll demonstrate first. Hold that for 1 second. I'm going to do is have you go here in your stomach.
Oh, my.
Just like this. Okay?
I will try, I don't know.
I don't know. We'll see. All right.
Where my elbow?
On your elbows. Yep. Use the chair if you need to. You can stand on the chair. So I want to see. This way we have more. There's more muscle strength required for this one. So go on your stomach. You'll be fine. Yep, just like that. And just relax. Actually, like this. There we go. There we go. Like that. There we go. So there. Now I want to work these muscles more, the erector spinae and high glute for one also. I want to bend your knee. And now bring that foot up here and hold that right there. There's the grunt. Perfect. Is that hard?
Yeah.
Good. Fantastic. So relax. To modify, you can do is start just bringing your foot here, and then now bring your knee up just a little bit. Higher, 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 higher. Just your knee. Right here. There we go. Right there. Hold that right there. Hold. Get that back stronger. 10 for 5 seconds. 5, 4, 3, 2.5, 2 1/4, 1.5, 1 1/4, 1 1/8. Is that it? 1/8? 1 1/16. And relax. All right? That's the goal. So you want to do both sides, again, 3 times each side. Hold for 5
But this
seconds.
is what they're doing in the bed or on the floor?
I like the bed easier because you get to get off the floor. The floor seems a lot hard to get off of.
Yeah.
Bed's fine. Good job, Maria.
It has to be something very flat.
Yeah. Flat and supportive, right? So floor might be easier, but the bed's okay too. And all your goal is to make sure we get that foot to come up a little bit off that table. To make everything, she's going to take a nap afterwards. She's done. She's done for the day. Nap. Any questions yet? Any questions? Lunge exercise, not a lung exercise, lunge exercise, okay? So here, what I do is take a chair with my patients and put it on the side over here. I'll go this way first. Here, I'm gonna do, get the camera to turn a little bit here. What I wanna do is take that chair for support on my arm. I want the legs and muscles to work, but I don't want to fall. Could be embarrassing, especially in front of you, ladies and gentlemen. All right? I want to start with a back lunge. The purpose of lunge is to make sure the hips, we've worked everything in one motion, here, up and down in one plane. Let's work a little bit of a twist in the hips if you're comfortable to get that back looser. All right? So what I'm going to do, use a table, side of your bed if you want, chair, couch, kitchen table, and slowly take a step back, let that foot drop. Then from this position here, slowly lower your body where you're comfortable. Hold for a second, then come back up. Maybe for 5 seconds or so. Switch sides. Other side. Drop your heel. So your body's going to be more straight or straighter. At that point, come down where you're comfortable and come back up. So both sides 3 times, about 5 seconds. You're working different muscles because you're twisting the hips, meaning that your knee is one here, one behind you, versus being more even in one plane. Same thing over here. One spot, 1 foot back, heel drop, body straight, come straight down, hold for a second, and come back up. Over time. You need to do this one. I almost would rather have more repetitions. Hold for a second, come up, versus the hold position. You're getting the muscles to move more like you would walking upright versus being stagnant or not moving. Any questions on that one?
But
Yes.
That's good to do it before we start acting, you know?
You want to warm everything up, right? Yeah.
That would be doing it in the swimming pool. Like
Perfect.
It's like a stretching, no?
Yep, exactly. And it's also if you're at home, same thing too. Can I slowly warm myself up by going maybe just a little bit down? Here, hold for a second, come down, hold, then slowly switch back and forth. When I start my day, everything here and here is warmed up so I don't hurt myself. Most of the patients come in from like non-traumatic injuries because in the morning they went to go pick something up. Their body's cold. They didn't warm up first. So my recommendation is I always stretch in the morning before I do anything. So at that point when I go to the gym, I'm warmed up for that. Less chance of injury. All right, I have life insurance, but that doesn't cover it if I get hurt. You know, it doesn't work.
It's painful too.
Yes, it hurts. And the thing is, once you have an injury too, right, our body compensates. So these stretches, the wall, the sitting, everything we talked about today too, allows you to relearn, okay, where's my body? How do I have my legs straight, my feet straight, body up here versus where it wants to go down here? If I have a hip injury or soreness or a chronic injury too, is my body shifted to one side? So using the chair, the wall, get your body reset and try to work with those areas where you're going to feel uncomfortable, not painful, just uncomfortable. At that point, our body will reset our brain, our cerebellum, to reset your posture here. So these muscles over time will adapt to your better position. That's the goal. How long does it take? 3 to 4 weeks. Give yourself time with movement, with stretching, get yourself looser and then stronger, then make sure you maintain that. Stretching every day, walking like this every day, so we're rolling our feet forward, not stomping, not sliding. All right? Any questions? These are a few exercises, not a lot, but the goal is to do them every day. The ones that you want to do and try, so your body gets looser, stronger, and better position. Yes? Good. So I'm going to walk. I'm going to walk heel to toe. And then if you want to use a wall or a chair or something, even walk backwards, toe to heel, to get your brain to reset everything this way too. And just slowly. I have my patients take about, when they have the improper walking, resetting it, take 5 steps on the wall, boom, one way, then switch sides, 5 steps the other way. So if you have a good day.
I'm coming back.
Okay, good. Now all you're doing is really regulating your heart. And the goal is, good question, is you want your eyes up here, not down here. Using the wall or a chair or a countertop, let your hands slide so it gives you that confidence you're not going to fall. So your body resets using your body to know where the ground is, where your body is, not your eyes. So that's one thing I forgot to mention. So you make sure you use when we're practicing, our eyes are up, not down looking at the ground or our feet. It takes time. Can't do it overnight. Any other questions? Questions, comments, concerns? Nothing? All right. It's the stretching, first of all. Joanne, especially too. Loosened up. Yep, yes.
Are you going to get to hands? I have a lot of pain.
I might have one coming up, I want to say in March or May, for hands and arms.
Okay.
That's, if not, I'll add it to my one either March or April. Yeah, I'll add it to it. Yeah, I'll try to remember that one. All right. And the one thing you can with, is it forearms or is it?
No, it's when I wake up in the morning, my
these 3 fingers are extremely swollen, and this
Yeah.
is all puffy.
So,
And I've been to the doctor, and they said, oh, it's arthritis, you're old, you know.
do you slap them? Give my copay back. Ugh.
Take Tylenol,
Like-
rub
Yeah.
some CBD, whatever on it.
Yeah.
But it's a lot of pain, and it feels like there's glass inside,
Yeah.
and
From all the pressure.
stabs.
All the pressure. So I like ice for swelling.
As the day goes on, it calms down.
It needs them. It's trying. It's if there's a lymph system, you have to naturally and physically move the lymph out of your body by motion. So before you go to bed, my routine for hands is bring your hand this way, push it back, hold for 5 seconds, let it relax about 5 times. This way. You're pushing the lymph down out of your body, out of your hand. And then other way. Now come down this way too. Hold for 5 seconds. Perfect. And then relax it again. 5 times. I always easy. 5 seconds, 5 times. At that point, slowly get that wrist and forearm to push all that fluid back into your body, not leave it here where it can swell.
And this bone here.
And styloid. Yeah. Yeah, it's part of that swelling area will make that bone more sensitive. Yeah. So the stretching for sure. Hold both ways, 5 seconds, 5 times. And really bring that hand to really push that tendon muscle to get everything out of your arm.
Oh, keep it straight.
Exactly straight, yeah. Much as you can, bring that angle from your wrist to your hand to really get that to stretch. All right. Little things you can do. You know, it's not age. It's not because it's only the one hand. It can come from the neck too. Not these very often from swelling, but it's something to where we have to move more. I think that's the key. Sometimes I had a patient, it was Rachel a couple years ago, told people before too. Her doctor told her because her back hurt, don't move. It hurts, just relax. So what happens is over 3 months, now she's in a walker. She can't hold her own body weight. And it's going to be uncomfortable. Does that mean it's going to be uncomfortable? But it shouldn't be painful or sore. But as you stretch, more ligaments and muscles stretch, you'll feel you can do more to where now you go, okay, that was painful before, now I can do more to get to a better comfort level where you have more range of motion, more movement for all of us. I stretch every day. I want to prevent the rigor mortis from happening. That's my plan. All right. Any questions? Anything else?
No.
Next month's talk is finding better balance, getting up from the floor safely.
You gotta be kidding.
Oh, you're my guinea pig next month. So next month, balance getting up off the floor. We all have to do that.